and say good afternoon, merhaba. Welcome, a warm welcome to all of you participating in this webinar today, organized by Hazel, the Association of Public Health Specialists, and Kocaeli University Department of Public Health, in collaboration with the Istanbul Policy Center. My name is Anne Stauffer. I'm Director for Strategy and Campaigns at the Health and Environment Alliance HEAL, where I lead our climate and equality programs. And I'm joined here today by the HEAL Turkey team, Funda Gatchal and Berke Haji Mustafa, as well as Elke Zander, HEAL's media coordinator. I'm delighted to see that so many of you are interested in the topic we're talking about today, heat waves and public health in Turkey. We have over 100 registrations to this webinar. With our esteemed speakers from Turkey and from Europe, we not only want to present the latest science on heat waves in Turkey, but also discuss how the health sector can respond, sharing some promising examples from across the European region. For over a decade, HEAL has worked to raise the awareness of the health impacts of climate change and engage the health sector on activities to reduce the carbon footprint and prevent ill health. From a handful of health representatives at the UN climate talks back in 2009, health engagement on climate has grown into a global movement 10 years later, with institutional health actors such as the World Health Organization or health ministries active, but also civil society engaged. And since last year, the ties between health actors have strengthened with a global WHO civil society working group on climate and health. And there's also a global network called Global Heat Health Information Network, which we'll hear more about in this webinar today. And we actually need even a broader health engagement. The Lancet Countdown is a unique interdisciplinary effort sparked by the renowned medical journal on tracking the connections between public health and climate change. The Lancet has shown that rising temperatures are already exposing people everywhere to an unacceptably high health risk. And millions of people worldwide suffer from heat stress. Heat waves as extreme weather events are increasing in their frequency, duration, and magnitude. And in fact, the WHO European region, which includes Turkey as well, is one of the regions with the highest risk of health impacts from heat, most likely because of a larger elderly population living in urban areas. And this year, the challenge to protect people's health is even greater with COVID-19 sweeping through the continent. So there's a lot to talk about. This webinar today is the first dedicated conversation on heat waves and public health in Turkey, sparked by a large interest of health actors in the country. The webinar is part of a new project on strengthening the Turkish health sector engagement on climate and environmental policies, financed by the EU, which HEAL is carrying out with our esteemed partners Hazel, the Association of Public Health Specialists, and Kocaeli University Department of Public Health. So welcome to our partners on this call, and also welcome to our collaborative partners for this webinar, the Istanbul Policy Center. In this three-year project, we aim to set up a platform on environment and climate change for all Turkish actors to join. And we'll be organizing a series of events and trainings, as well as providing educational materials. And last but not least, we want to strengthen the exchanges between the Turkish health sector and colleagues across Europe and internationally. So I'm delighted that we're starting this conversation today. So we will be hearing today 4 presentations and then have a discussion, which will be moderated by my colleague Funda. And all of you participants, and of course also our speakers, have the opportunity to be part of this conversation and comment and ask questions. I now announce some housekeeping rules. And first of all, translation. There is simultaneous translation, English into Turkish and Turkish into English. And thank you for interpreters Ceren Bektaş and Esin Aslan for that. And if you would like to listen to the English translation, you need to go to the bottom of your screen, click on the icon Interpretation, and select the English option. If for those of you who want to listen in Turkish, please choose the French option. Unfortunately, there's no Turkish flag there. Then for questions. If you have any questions or comments, please send them either in English or Turkish. Both languages are fine. via the Q&A box. So again, if you go to the bottom of your screen, you have a box called Q&A, and there you can type in. And Funda and I will be reading your questions and then relaying them for the discussion. It will not be possible to ask the questions directly with your microphone, except for our speakers, of course. And we will have 1 to 2 clarification questions after each presentation, and then a longer discussion following all of the 4 inputs that we're having today. This webinar will also be recorded and published afterwards on YouTube. And last but not least, if you have any technical difficulties, please contact my colleague Berkay for those of you from the Turkish participants, and my colleague Elke for any of you from other countries. And now I'm pleased and delighted that Professor Dr. Toker Ergüder is with us. He's National Professional Officer, Non-Communicable Diseases and Life-Course at the World Health Organization Turkey. Dr. Ergüder has worked on tackling tobacco use in the WHO Turkey office and is leading the Turkish office work on non-communicable disease and health promotion. And Dr. Ergüder, you'll present to us today on WHO Turkey's approach to environmental health. Warm welcome and looking forward to hearing your thoughts. Thank you.
Thank you very much. I am very pleased to join this webinar today. And I want to thank all organizers on behalf of the WHO and WHO Bonn Office for Environment and Health. So I would like to continue my presentation in Turkish because most of the participants are Turkish-speaking colleagues. And so, but my slides are in English, so it will be easy for the interpreters to follow up my presentation. But I would like to speak in Turkish and for easy follow up my presentation. Ya ben de herkese çok teşekkür ediyorum.
I would like to thank everyone as well. Most of the people attending the webinar are from Turkey, so I wanted to continue in Turkish, but my slides are in English. And I would like to thank all the participants for attending and Heal for the organization and Hasudar as well. This is, of course, a very important topic, and I would like to briefly inform you about the WHO approach to this. So who is the the World Health Organization? WHO is part of the UN system, and its primary role is to direct and coordinate international health, and it is basically the expert institution of the UN for health. And WHO has its headquarters in Geneva and has 6 regional offices, and Turkey is also connected to the European region. There are 53 countries in this region, and Copenhagen, the capital of Denmark, is the regional hosts the regional office for the European region, and there are around 8,000 employees under this roof, and there are 194 members of WHO, and all types of health-related issues, including environmental health, are areas where WHO tries to provide guidance in. Usually WHO works with Ministry of Health in countries, and we usually work in collaboration with governments, but along with that we also work with other partners, especially supporting countries in national health strategies. And also work with NGOs in line with the decisions taken by ministries. And in Turkey, we work together with the Public Health Specialists Association in Turkey. That's a good example. We try to work together in many projects, and as part of those projects, we try to provide technical support to NGOs And of course, I would like to briefly talk about the definition of health as well. Currently, for 72 years, we have a definition of health we have been using, and it is part of the constitution of WHO. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So since social well-being is very important, the social factors impacting health are very important as well. So when we are talking about social well-being, we're talking about socio-economical, cultural, and environmental conditions as well. So well-being is not just the absence of disease, but also the environment people are working in, access to fresh water, unemployment issues, environmental health. These are all part of well-being. So WHO works with 5-year programs, and in 2019, the 13th program was published, and in the 13th program, together with Dr. Tedros taking office, there was an effort to put more concrete goals in place. So providing 1 billion more people enjoying better health and well-being, 1 billion more people better protected from health emergencies, and 1 billion more people benefiting from universal health coverage were the goals set. So WHO has shifted its plans in line with these goals. And of course, WHO has some rules for health and environment as well. One is global leadership and advocacy, and especially knowledge management for policy making, and also providing guidance for normative elements, and policy and technical assistance, and monitoring and evaluation. All these activities are some of the roles of the WHO. Now, of course, this 3 billion more healthy people goal of the WHO is also part of the SDGs of the UN. It is in full harmony with these goals, and there are around 50 indicators we can find as items of this topic, and all of these are in line with the indicators of the SDGs, and we are monitoring them in the same way. As you can see, there are 16 goals here, and the third one is good health and well-being. But of course, as public health specialists or health specialists, we want this third SDG to be the center of all the others. And in this third SDG, there are 9 targets, and there are targets about chemicals and air pollution under 3.9, and there are some items about mortality rates tied to air pollution from the environment, and poisoning, unsafe water sources. These are all part of 3.9, but basically these SDGs need to serve the third SDG, because from poverty to sustainable energy, all of these are also contributing to reach the goals in target 3.9. And in the European region, mortality tied to environmental factors is 23% of all deaths. There are about 50 million deaths in the world yearly, and 7%, so 40 million, are linked to environmental conditions. So 12.6 million people are losing their lives because of unhealthy environmental conditions. And in the European region, this figure is 1.4 million. And what's important for us is that all of these non-communicable diseases, 25% of them are of people of under 60 years old. And we can see that most of these are cardiovascular diseases, cancers. They are diseases related to smoking and high sodium intake. And especially in the European region, all these environmental risk factors are responsible for 26% of ischemic heart diseases, 25% of strokes, and 17% of cancers, and they're leading to the death of this many people. And economic activities, urbanization, air pollutions, inequality in health, and with migration and with technological developments, these environmental factors are worsening. And in 2019, WHO worked on a new global strategy, and there are 6 strategic objectives in this global strategy on health, environment, and climate change. Primary prevention, cross-sectoral action, strengthening the health sector and monitoring this, building support, and these are the topics that will be part of the strategy. And in the European environment, most of these activities related to the environment started as of 1989, and WHO, with the support of the German government, established the Europe Environment and Health Center in Bonn. And after 1989, the issues related to environment and health were carried to the agenda of the countries in Europe. So 53 countries in Europe are provided support through this center, and they try to provide all types of support. And here in a while, if you go on this website, you will see tens and hundreds of documents and guidelines about environment and health. Now, of course, this journey starting in 1989 was completed with the Ostrava Declaration in 2017. And at the 6th Ministerial Conference in Ostrava, environment and health were carried to the agenda of governments once again through this declaration. And these are the priorities of the Ostrava Declaration. And again, these are in full harmony with the SDGs, improving air quality, ensuring access to safe drinking water, sanitation and hygiene, minimizing the adverse effects of chemicals, preventing and eliminating the adverse effects of waste management and contaminated size, and strengthening adaptation to and mitigation of climate change, supporting cities and regions to become healthier, and building the environmental sustainability of health systems are the priorities. And there's something I'd like to emphasize here. Better health, better environment, and sustainable choices was the motto of this declaration. And of course, there are efforts to make sure this is always on the agenda of the governments in the European region. And here we can see the Environment and Health Center documents, the center in Bonn. You can also access these documents through the website. And these are all very important guidelines about environment and health, from carbon reduction to noise levels. In a range of subjects, you can see some proof-based documents, and science people from 53 countries of Europe work together to create these documents. And with permission from the WHO, these can also be translated to Turkish or any other language of desire. So WHO really facilitates such activities. I do want to show a few more slides as I am ending my presentation. Now, as public health professionals, we are trying to push people uphill, but we also need the other sectors to reduce this elevation. So education, appropriate food and nutrition, employment, proper housing, these are all very important factors. As we can reduce the negative impacts of these factors, it will be easier for us to push people towards a healthier life. So what is the solution? Putting health in the foreground in all decisions is very important, especially multi-sectoral activities are needed. And there is a requirement for a whole of government, whole of society approach. And we also need to work outside the health sector to fix the socioeconomic and environmental factors. And I would like to end my presentation with this. I took this from Facebook and I liked it. That's why I wanted to add this. It says, when the last river dries, when the last tree dies, when the last fish dies, the white man will learn that money is not edible. And this basically summarizes everything I have tried to say. So everyone needs to focus on sustainable development, and they need to be careful about public health and environment. And this presentation was prepared together with my colleagues in the WHO Bonn office. And I would like to thank Mrs. Francesca Rasiopi and Dr. Vladimir Kandrowski for their contributions in this presentation. Thank you.
Thank you very much, Dr. Ergüder, for giving us this comprehensive overview, and quite challenging in this short of time to talk about the many activities the WHO has carried out. And I mentioned in my introduction that 10 years ago it was only a handful of people who looked into climate change and health, and definitely WHO was among those and has really been instrumental in bringing climate change issues to the forefront. For example, they were one of the first ones, the WHO Europe, to adopt a regional framework on climate change and health, including such issues as monitoring and preparedness of health ministries and the sector. And looking forward to continuing the conversation and the collaboration with you. There are no questions, so I'd like to go on right away to our next speaker, who is Dr. Umit Sahin. He is senior scholar and the coordinator of climate change studies at the Istanbul Policy Center, which is a research institution at Sabancı University. Dr. Sahin teaches courses on global environment at Sabancı University. He is also a juror for the Mercator IPC Fellowship Program on Climate Change and has been a long-standing member of climate and environmental movements. Dr. Sahin will now present the evidence on heat waves and health effects in Turkey. Thank you very much, and the floor is yours.
Thank you, Anne, and thank you for your this very important organization. And I also like to speak in Turkish because most of our audience speaks Turkish, like Dr. Ergüder. I think now you can see my screen, right?
Yes, we can.
Yes.
Okay. Merhaba. Ben
Good
de
afternoon.
önemli organizasyon için teşekkür ediyorum.
First of all, I'd like to thank the organizers for this important event. Now that we are globally going through heat waves around the world, I think this international meeting we're organizing here is quite timely. In my presentation, I'll briefly try to introduce what heat waves are. I'll give you some definitions, and I'll try to introduce some information from Turkey's perspective. Especially, I'll explain how heat waves have increased in Turkey, and I'll try to dwell into the diseases and other problems caused by heat waves in Turkey. But before I continue with heat waves, I'll share with you a couple of slides about the latest condition of climate change around the world. In this slide, you see data related to the past year, from July 2019 to June 2020. Temperatures around the world are increasing, and compared to the last half of the 19th century, the global temperature increase is 1.3 degrees Celsius. This is an alarming figure, actually, because it's been only 5 years when we reached 1 degree increase, and in the last month, the increase has gone up to 1.3 degrees Celsius, which is why we are going through many heat waves around the world now. 2020 will probably be the hottest year on record, or will be the second hottest year on record after 2016. But this is a worrying tendency, because in the Arctic zone and in Siberia, we know that temperatures have risen up to 38 degrees Celsius, and it is ongoing. The most direct impact of climate change and global warming are events which are related to increasing temperatures. Extreme heat and heat wave are two different concepts, actually. Extreme heat is a more general definition. However, heat wave describes a period of a couple of days with condensed heat. And soon I will show you the impact of heat waves on mortality rates. Think of heat waves as a phenomenon impacting many different factors, such as health. It has impacts on the environment as well. For instance, a couple of years ago, Greece went through the severe wildfires. And around the Mediterranean region, we know that there have been some important fires, forest fires, in northern Africa as well, in an unprecedented manner. In the Amazons, in Siberia, in Australia, the wildfires were immense. The second impact is drought. And it is one of the direct impacts of heat waves, actually. And because of low rainfall, we have drought as well. There is also another concept called loss events. These are events which lead to mortalities or economic loss. So let's have a look at the number of events from 1980s to 2014. Apart from geophysical events like earthquakes, all other events are related to climate change. They are either meteorological, climatological, such as storms, tornadoes, landslides, and their numbers are increasing. At the top, you see the orange part of the bar. These are related to climatological events. Extreme temperature, drought, and forest fires are the individual events, and the number is also increasing, as well as the intensity of these events. Intergovernmental Climate Change Panel, IPCC, released a special report on 1.5 degrees a couple of years ago. And according to this report, if we limit the increase in temperatures to 1.5 degrees, the heat waves intensity will be 1.1 months actually. If we can limit global warming increase to 2 degrees, then we will have heat waves up to 1.5 months actually. However, when we look at the current tendency, we see that the temperature increase will be around 3 to 3.5 degrees Celsius in the next decades. So there are worst case scenarios which define that we will have more severe heat waves around the world. And now let's have a look at the impact of heat waves on urban areas. There are 5 groups. One is sea level rise, food insecurity, extreme weather events, increased temperatures, and fresh water availability. Increased temperatures and heat waves have severe effects on urban areas. It causes vulnerability, and they also lead to health-related and economical problems as well. Climate change does not only impact health through heat waves actually. You know, The Lancet, one of the most important medical journals of the world, it released a report in 2009, and in this report they said climate change is the biggest global health threat of the 21st century. Later on, in 2015, they released another report stating that fighting against climate change will bring the biggest gains in terms of healthcare system, including vector-related diseases and waterborne diseases. Climate change causes many different types of diseases, but apart from these causes, I'll talk about heat wave-related health problems. Because heat waves or increased temperatures are the most direct impacts of the climate change on human health. Let me also give you a couple of recent reminders. These are articles from newspapers in Turkey. In May 2020, to be more exact, on the 2nd or 3rd week of May this year, Turkey, Italy, Greece, and Spain went through extreme weather conditions. In May, we witnessed 43 degrees Celsius in Turkey. This is something which we're not used to. This is more than the threshold, actually. And the record in France was 46 degrees. And this map shows how widespread heat waves were in 2019. There were huge heat waves encompassing all Europe. But of course, heat waves are not limited to Europe only, especially India, African countries, and many places in Americas go through heat waves with high mortality rates. It is important to define what heat wave is, but it is different than extreme heat or It requires action plans, it requires measures. We do not have a single definition globally used for heat waves. There are many different definitions, but what's important is to understand that heat waves are specific to a region. Heat waves do not hit an entire continent or an entire global region. They mainly affect an urban place or a specific city or a part of a country. And for us to call them heat waves, they have to happen in warmer months of the season, of the year, like spring and summer. And we have to define heat waves as compared to the mean temperatures or normal temperatures of that region. So we first have to have an understanding of what mean temperatures are in a specific period, for instance, for 30 years, to be able to make that comparison. And heat waves should last a couple of days. We do not expect them to last months. And they usually affect larger areas than other extreme weather events. For instance, if a city is hit by floods or storms, they affect only one part of that city, but heat waves usually affect larger areas around that city, and they affect everyone. Heat waves harm human systems by affecting their health, economic activities, and infrastructure in urban areas. They use different heat indices to define heat waves. For instance, maximum temperature of a day, minimum temperature at night, mean temperature of a day, parent temperature, humidity, wind speed, wet bulb temperature, and humidex. World Meteorological Organization and WHO defines heat wave as a of people, agricultural losses, and an increase in many risks such as health-related risks, wildfires, and power shortages. And it has to happen at a specific region, and it should last at least 3 days. And over the course of those 3 days or 4 days, the temperatures are above the average. And you have to understand the threshold by looking at epidemiological studies in a region. If there are no such evidence-based studies in a region, you can use more generic definitions to define the threshold between the heat wave temperature and the normal temperature. So in Turkey, we do not have such evidence-based studies. Therefore, for Turkey, a 3 or 5 degree increase from normal temperatures is defined as a heat wave. There are certain studies conducted in Turkey on heat waves. Kugdish and his friends looked at the Mediterranean region in Turkey since 1960s. They checked the length, intensity, and the number of heat waves, especially in the hot spots around the Mediterranean, the Black Sea coast, the western part of Turkey, and the eastern part of the Balkans are affected the most from heat waves. Another study looked at summer heat waves over western Turkey between 1965 and 2006. And the number of hot days, heat waves, and heat wave related causes have increased in that period of time. Gürkan and colleagues also made a study sponsored by the Turkish Meteorological Institute that the total number of heat waves in Turkey increased between 71 to 2016, and climate change is one of the reasons behind it. According to RCP 4.5 scenario, the number of days with heat wave per year is expected to increase between 20 to 110 days, with an average of 42 days. And according to a worst scenario, which is RCP 8.5, the number of heat waves per year is expected to increase by 78 days, which means that the entire summer will be a huge heat wave. Let me shortly explain mortality and morbidity studies as well. What's special about this study is that they show how many people die or get injured or get ill during heat waves. But you have to look at the reasons why these people die, because at the hospital they're not recorded or registered as because of heat waves. So we understand if these people die because of heat wave by looking at the excess deaths in that period. For instance, in 1987, 2,000 people died in Athens heat wave. In 1995, Chicago lost 700 people, and in 2003, hundreds of people died in Europe. Recent examples, in 2016 July in California, 655 excess deaths happened. In India, in May 2010, in Ahmedabad, 1,344 people died, and in Switzerland, in the summer of 2015, 804 people died. There are other and more different epidemiological studies. Between 2000 and 2010, in 18 cities in France, 1.2% of all deaths are heat-related. Another study looked at the Washington, King County, and it found that from 1980 to 2010, summer months resulted in mortalities because of 10% more hot days. Another study looked at the cities of Europe, and even a 1 Celsius degrees increase led to many excess deaths. We don't have many studies looking at Istanbul or Turkey. There is one published by us last year from Public Health Department of Cerrahpaşa University, Istanbul University, and it's a joint study with Canadian colleagues. And we looked at heat waves between 2013 and 2017.
Ölüm riskinin, yani mortalitenin %11, %6 ve %21 arttığını sırasıyla bulduk. Bunlardan %21 olan, en ciddi ölüme neden olan Haziran ayındaki, 2017'nin Haziran ayındaki sıcak dalgasıydı. Ve toplam ölüm sayısının bu 3 sıcak dalgasındaki ekstra ölüm sayısının 419 olduğunu İstanbul'da hesapladık. Yani İstanbul'daki 3 sıcak dalgasında toplam 14 gün süren 3 sıcak dalgasında toplam 419 kişinin beklenmedik ölümüyle karşılaştığımızı gördük ve bunlar bütün nedenlere bağlı ölümler tabii, ama özellikle kardiyovasküler sebepler, 75 yaş üstü ve kadınlarda ölümün daha fazla olduğunu yine özellikle Haziran 2017'deki sıcak dalgasında gördük. Ben süremi çok aşmamak için
Excuse me, just one moment. I've lost the English translation.
Sorry, I was on the wrong channel. I'm very sorry. I'm back.
Okay.
Sorry.
Thank you. Thank you.
So I want to skip this part very quickly. I know the other speakers will talk about this as well. The risk groups are very important, especially the elderly and those with diseases and those working outdoors. But I just want to touch up on a few points and end my presentation. Uh, First of all, acclimatization is very important. When the heat period starts, the organism, the human body, which is coming from a cooler term, needs a few weeks to adapt to this heat. So in early summer, May and June, the heat waves that occur in those times create higher mortality rates. And secondly, the health impacts of heat are not just about mortality. It can lead to rashes and all the way to comas. So that is something that we also need to know. And especially health professionals need to be able to recognize this and diagnose this. Ozone pollution, so summer pollution, increases with heat waves, and together with the impact of heat waves, the impacts of ozone pollution also create similar health impacts. And also the night temperatures are very important. Why? Because during the night, the body cures the heat stress created during the day. But when there's high humidity during the night and the heat is high, the body cannot cure itself, and that can also create negative impacts for health and lead to mortalities. So it's not just heat during the day, but heat during the night is also an important risk factor. So I would like to deliver my takeaways here and then end my presentation. What we need to say here is in terms of health impacts, especially of heat waves, they are preventable, especially the government, Ministry of Health, and local governments should be aware of the importance of heat waves. And heat waves is one of the greatest impacts of climate change, the most mortal impact, because sometimes hot weathers are considered good weathers. However, we need to know that these hot weathers can lead to mortality. And especially in terms of socioeconomical factors, the hot weathers may not be experienced in the same way by everyone. And we are usually used to receiving warnings from the Meteorological Institute in Turkey, but health professionals and local governments need to work together with the Meteorological Institute for warnings. And there needs to be city-specific local thresholds that are identified. Heat warning systems need to be established, especially in cities, and heat health action plans should be prepared. And this is something proposed by the WHO to all governments as well. And all these types of warnings can be on billboards, on screens, so they need to be announced publicly. Unfortunately, in Turkey, we are not familiar with such practices yet, but with increasing heat waves and increasing health impacts, I guess we can say that these activities will be initiated in Turkey as well. And finally, last year, the Istanbul Policy Center published a report that I tried to write. It's a report about heat waves. It's in Turkish, and you can find it on the website of the Istanbul Policy Center if you wish. Thank you for listening.
Thank you very much, Dr. Sahin, for this. A lot of food for thought, and I think many issues for us to be discussing, including the availability of data, but also the awareness of both health professionals and the public on the health impacts of heat waves. In the interest of time, I would now like to move on to our next speaker, but encourage all of you participants to don't be shy, type your questions, type your thoughts in the Q&A so that we can have a conversation a bit later. We still have 2 presentations to go. And the next one is by Dr. Peter van den Hazel, somebody I know very well, as he's the president of my organization, Heal, and also the co-founder and president of INCHES, the International Network of Children's Environment and Health. And when Peter is not chairing and presiding over these 2 organizations, he's working as an environmental health specialist for municipal health services in the Netherlands. And Peter, you have also coordinated several EU-funded research projects on climate change, environment, and children's health. And today you'll be presenting to us the work of the Global Heat Health Information Network and Occupational Health. Thank you very much, and the floor is yours, Peter.
Thank you. Can you hear me? Good evening, everybody.
Yes, we can hear you.
Can you see the screen? Okay. So I will present a mix of topics, so heat health effects, climate change, and occupational challenges. So I'll probably focus a bit more on the last one, because otherwise there will be too much overlap with the other presentations. Let me go. So I'll give an introduction about the background, some of the changes that Umit also has been addressing on monitoring effects and on action. Just to give you an overview how complicated it is, what we are talking about, this just gives a picture on how heat in urban areas is influenced by the sun, but also by all the things that we are doing there, the surfaces, the albedo effect, the reflection, the turbulences. So that means that if you want to look at heat in cities, you will have a lot of different locations next to each other where there are different heats being experienced by people. Generally said, the greener a city is, the less influence heat will have on human health. This is a picture you already seen in the previous presentation. I would like to focus here on the top left of the screen, where we are talking about heat-related illness, death, and cardiovascular failure. But what you can see nicely in this picture is that rising temperatures are also linked to the other areas, like air pollution, like the migration that you see around the world. So there is this wheel of impact of climate change on human health. It's not only that we have to look only at extreme heat and the rising temperatures, but also on all the other factors that are linked to this. Just to give you an idea of the situation in my country, the Netherlands, I just give you a few examples, but I think in every country we see that records are being broken on temperature in many places, many parts of the world. And to look at this in a more longer time perspective, you can see here on the screen a shift of distribution of the summer temperature anomalies, that from the 50s up to now we see really a shift towards the more extreme temperatures in the northern hemisphere. So we see also the shifting in cities, what was addressed before, and according to the different scenarios, we will face more and longer periods of high and even tropical temperatures. These are a few other examples of heat waves compared to also the other disasters that we can see around the world. But heat waves are surely more and more frequently seen in this list of disasters. What we can do and how we can make it more visible is, for example, this tool that we're using in my city, where we are making physical mapping, where you make a combination of the surface water, the buildings that are there, how much paved areas are there, how people are experiencing heat, the heat flows of the wind coming either from the forest or from dry and flat areas, and also looking at the differences in temperatures of indoors and outdoors, which is sometimes quite a big issue for people living inside houses that hardly can be cooled down. if you combine all this, then you can draw these kind of physical maps, where what we call heat maps, where you can then really see which are the areas that are the most vulnerable for people to live. And if you're on the next slide, where is the next slide? Sorry. That's gone, I think, or not. Well, now this is just an example where you can see on a map the different areas where the heat islands are, and usually it's all the cities, but sometimes you also see some areas where there is a lot of industrial activity. This was the slide I was looking for. If you combine the heat map and you make it into a social heat map, what we are doing is looking where the most vulnerable people are living. For example, the people in age above 75. You can also look at where children are living, and you can also look then at the mortality data and combine these with the heat map on the previous slide, so that you can really focus on areas where you should look for how to make the city maybe more livable or greener. Then I will move to a little bit to the occupational side. I was participating in a project called Heat Shield, which had really the mission to look at the negative impacts of the workplace by heat on health and also the productivity of work. And we have been doing this in the tourism sector, agricultural, manufacturing, construction, and transportation, mostly in professions that are performed outside. And here you can see some of the countries that were participating in this project. It is true that what is seen that in the initial days of a hot period, people are able to adapt. But if you look at much more detail, you see how some adaptation measures in our body are quicker to respond to heat than others. So, for example, heart rates, it seems to adapt quite quickly, but some other people don't adapt or even get worse when you are longer period in heat. So even what you can read at the bottom, even for people with many years of work experience in hot settings, we still observe large individual differences in the impact of heat, both on performance and on physiological symptoms. So it's not that you can say this is true for everybody. Really, we do see differences between people, and so we really are interested to see how people can adapt themselves, but also what kind of people are more vulnerable to heat. If you look at, this is a picture of how data have been collected in people working in the construction business. What has been done is while they were working, that we looked at the core temperature. You had different methods to look at people's core temperature on an ongoing basis. And you see here, people working in construction, that they really get, during a work shift time, a temperature which is almost like, yeah, you can call it like a febrile temperature. Agriculture, that's less obvious that people have a rise in temperature, and maybe that's due because they are more outside, where either the wind might be blowing, or that they are better protected, or that they can dress themselves differently than people working in construction. Other pictures the same for tourism, and on the bottom one is the one that people working in industrial settings. So also there you see that there is a rise in core temperature, body temperature. What does this mean? If people are having higher temperature and the air temperature is higher, and then it means that in part in some jobs the core temperature will see that it will affect the amount of work that people can do. So the lower the heat stress, less people are having accidents, less people are have to stop because they can't cope with the work anymore. The higher the heat stress, the less people are able to continue work. So there is really both a health issue, but also an economic issue to make sure that the temperature doesn't go up too much. So in that summarizing that we really see that there are effects on European workers with health risks and also the loss of productivity. If you looked at the city and you're not only looking at occupational people, then you can look at how to plan your action to, in the near future, how to cope with rising temperatures in urban settings or in occupational settings. For the public space, we are really looking at methods to create more shades or to make more green, more plants and less hard concrete surfaces, or maybe, like you can see in the picture, create plazas where people can cool down with water. Also, we have to look at our housing. We have to make sure that people change their behavior so that they can protect themselves better against heat. For example, by sun screens, ventilation, or if you can afford it, by air conditioning. In work, we really see that we have to hydrate people better. One of the research projects of the Heat Shield project showed that people coming at work early in the morning already were dehydrated. So that means that when they left home, they probably had a night at home which was probably too hot, and that they, instead of cooling down at home and were able to hydrate themselves again after they work, that they even became worse dehydrated than after work. So this is really an eye-opener, that we have to take care of people arriving at work in a well enough hydrated status. Also, there is more and more research done on how to look at the work and rest times during a day, and that you can really look at what are the best ratios between work and rest to avoid people having any health heat effects. There is a lot of clothing methodologies available for specific professions, with cooling vests, ventilation vests, and other clothing materials that are enabling people at least to stay cool longer during work. And another way is to see if in some occupations we can mechanize the workloads a bit more. So summarizing mechanization, for example, in agriculture, clothing could be much more improved, the work-rest ratios and hydration, which is probably the most important one. In addition, there is also now the availability to look at personalized early warning systems. In the Heat Shield project for the different professions, again, agriculture, construction, etc., these kind of leaflets have been produced to prevent problems for these specific jobs. And also there has been a web-based tool produced which uses the weather forecast that can be done everywhere in Europe with the individual physiology. So a person has to tell in this app if they are easy sweaters or if they are, what their body weight, etc. is, and then we can combine that with working conditions and with the weather forecast, so that they get on this app a warning for the coming few days, how the temperature will possibly influence their health status, so that they can take more preventive measures to either hydrate themselves, or that the job owners, that they are giving more protection to their workers. And this app can be downloaded on the website, what you can see at the bottom of the screen. This is just a little repeat what has been said before. The vulnerable groups where we have to look at, the elderly people, the young people, not to forget also people with chronic diseases like asthma and occupational settings. And I would like to add here also people that are using medication, because what we see is that certain kind of medication, like medication for psychological problems, but also for people with renal diseases or asthma diseases, that some of this medication you have to adapt the dosage of the medication during heat waves, otherwise you will increase more health problems than curing them. Finally, looking at interventions, again, look at target groups, how you can protect elderly and young people, promote the heat stress reducing behavior, and that's something that I think we should look at really at a local level through public health sectors, but also through general practitioners, how we can help people to change their behavior. Determinants in that are that we need to provide enough knowledge. There's a lot of leaflets, etc., available which can be used. Increase the risk perception about heat. Reduce the barriers to heat stress so that people can really adapt their behavior, and increase the social cohesion also for action so that people can look after each other. That means that you have the following functions: education, you need to convince people by material, you have to make people able to adjust to the environment, for example, by greening the cities, and we have to facilitate that people can take these actions. And then concluding, so heat, health, and climate change is not addressing really in the future the boundaries of our planet, but currently already at this moment it's addressing the urban boundaries. What can we really cope with in cities, and how do we have to deal with that? Water issues will be becoming more and more urgent, but water is really needed either on a personal level but also at a global level. We have to step up with innovation of urban design to make our cities able for people to continue to living in higher temperatures. And I already mentioned several adaptation measures for occupational situations. We have to prepare the healthcare sector for more health-related diseases. So that is what we also found in another project, that hospitals, the public health sector, we need to train more people in the healthcare sector to be able to cope with these more frequent heat-related diseases. And I hope that I have given you some information on this important topic on heat, health, and climate change. And I thank you for your attention.
Thank you, Peter, for this comprehensive presentation, adding yet more things to talk about later. And thank you for highlighting this heat shield, the app, which I didn't know about. So I think that's very useful. Okay. And also what you said in terms of the importance of urban design, urban planning as a way to prevent heat stress. And I think this summer especially, with COVID, we have, if you want, a renewed focus on workplaces and working conditions. And as you were talking, I wondered, we're not thinking, so many people are asked to work from home now, and actually we're not thinking about potential increases there of heat stress. So I wonder, again, if there's an opportunity to make workplaces both, if you want, COVID-proof and heat-proof. But yes, for further discussions, as we have one more speaker to go, which is thank you, which is Dr. Karine Laaidi. She's project manager on climate and health at the French Public Health Agency, and we're keeping fingers crossed now that it works with your presentation, Karine. And Dr. Laaidi is an epidemiologist who's been involved with the French Public Health Agency's activities for a long time. Her expertise includes pollen allergies and environment, heat waves, cold spells, as well as mental health and climate. And you will be presenting to us today on early warning systems in France. The floor is yours. Can you share your screen? Karine? Oh.
Do you hear me?
Ah, yes, now we hear you. Wonderful.
Okay.
Yes.
And do you see my screen?
We cannot see your screen. So I'm asking my colleague, well, can you try? Have you tried?
Yes. Is it okay now?
No. If not, I would ask Funda or Berkay if you could bring up the presentation, please. And then, Karine,
Sure.
you would give us a prompt when to turn the slides.
Okay.
Sure.
Thank you. Mhm.
Hold on a minute. Okay. Karine, let me know when you want to pass to the next slide.
Okay. Okay, so I will present the surveillance and prevention of heat waves in France in the COVID-19 pandemic context. So next slide, please. So in France, a national heatwave plan has been implemented in 2004, just after the 2003 major heat wave and its dramatic impact on mortality, around 15,000 excess deaths. So the plan is organized into different sections. The first one is the warning system, which is managed by the weather services in close collaboration with the public health sector, in order to produce daily a vigilance map with 4 levels of warning: green, yellow, orange, and red. And when there is an orange or red alert, our public health agency follows health indicators to adapt the management measures and to review the impacts at the end of the summer season. And a set of measures is available for the stakeholders during an alert. For example, communication of preventive actions, cool rooms in nursing homes, emergency planning in hospitals and nursing homes, recommendations for health and social workers, and identification and help of vulnerable people at home by mayors through city registers. Next slide, please. So in this plan, the role of local stakeholders is crucial. They adapt the plan to the local context and implement management and prevention measures. For example, they open a free call center dedicated to heat information. They take measures to help the population stay cool, like wide opening hours of swimming pools, street fogging, web apps to record cool places. And they also take measures to help the most at risk, like the homeless and the elderly who are isolated at home. Next slide, please. In regards to the heat warning system, it is based on meteorological indicators that are the 3-day average of night and day temperatures, which are associated to local alert thresholds. Worsening factors can be used to slightly adapt the warnings, like precocity, intensity, and length of the heat wave, air pollution also, or high humidity. And especially this summer, local COVID vulnerability will be added to these worsening factors, and its assessment will be shared daily with the weather services. High vulnerability may lead to rise the warning level from yellow to orange, or from orange to red. And the health impact of heat on emergency visits is also integrated in this decision of warning. And all these indicators are used by Météo France, the weather services, to establish a vigilance map each day. Next slide. Okay, when the warning is orange or red, we follow a set of health indicators. The first one is mortality, which is followed from a panel of 3,000 computerized cities, which represents about 80% of all mortality. But it requires 1 month to collect the data for a given day. And so we use this indicator for seasonal assessment only at the end of summer. We also follow deaths from heat on work premises. And in regards to morbidity, we follow quite real-time emergency data from hospitals and GPs visits at home. So you can see on the map on the right side of the slide, the cover of those data sources, which is very high despite local discrepancies. And these morbidity data are followed globally for all causes, all ages, for different age groups, and with a focus on specific causes like heat stroke, dehydration, hyponatremia, dizziness, or fever. And especially this summer, we will add hospitalization in ICU for causes linked to heat, in parallel to hospitalization in ICU for COVID that are followed since the beginning of the outbreak. Next slide. Yes, the morbidity data are followed daily to adapt the preventive communication and the management measures. For example, if we see an increase among the elderly, we can recommend to focus the communication and management on this specific population. So you can see on the graphs the evolution of those data for last summer. The first graph represents the percentage of the population concerned by each level of heat warning. And the two other graphs in blue represent the evolution of emergency visits for heat-related causes in hospitals and by GPs. And all those data are very correlated. Next slide. The mortality data are used at the end of the summer to review the impact of heat. You can see on the graph and in the table the number of excess deaths each summer, with the dramatic peak of 2003. Usually, the major impact is found among people over 75-year-olds. We also recorded deaths from heat among workers, 12 in 2018 and 10 last summer, mainly among builders on site and men. Rarely we observe excess deaths among children under 15 years old, but it was the case in 2015 with 49 excess deaths, probably due to an early heat wave at the end of June when children were still at school. We also observe each year geographical discrepancies of mortality, as you can see on the map on the right, due to the characteristics of the heat wave, the age distribution of the local population, and the type and amount of preventive measures taken locally. Next slide. This summer, we'll have to adjust our watch warning system and prevention due to the influence of the COVID outbreak. Actually, the COVID has an influence on heat exposure due to lockdown of heat people, to restricted access to cool places, to ventilation restrictions, or to the wearing of protective gear. The COVID also has an influence on individual susceptibility due to social isolation, exhaustion, and synergies between symptoms of heat and COVID. And finally, the COVID influences the access to healthcare because of social isolation, lockdown, conflicting risks perception, and disruption of the healthcare system. And all of this can increase the final risk of death during a heat wave. Next slide. So the High Council for Public Health produced recommendations to cope with heat in the pandemic context. The main recommendations are first that health professionals must be trained to identify COVID versus heat-related symptoms and to adapt treatments. Access to cool places should be authorized with relevant COVID prevention. For example, parks and cool areas and public showers should be available. Adequate ventilation or air conditioning systems must be used and well maintained with appropriate filters. At-home visits of the most vulnerable must be maintained following COVID key preventive behaviors. And finally, the number of protective gears against COVID should be increased. Next slide. Regarding those recommendations, the heatwave communication plan was adapted to the pandemic context. Dedicated TV and radio spots were produced to give advice on heatwave and lockdown. Prevention flyers were modified after the old ones on the left of the slide were tested among a panel of population. And the new flyers, you can see an example on the right side of the slide, don't include anymore a fan and focuses on drinking and staying in cool places. COVID visitors of the elderly at home are trained to provide heat-related advice, and town halls may be authorized to cross databases to better identify vulnerable people for COVID and heat. Next slide. Yes, so now I would like to present 3 assessment studies we conducted. So the first one was conducted in 2015 to collect the knowledge and practices concerning heat risks and prevention among the population. And it mainly showed that risks and prevention measures are well known, which is good. It showed also that the elderly often search for help among close relationships, but only 4% register on town lists, which are supposed to help them. And the study also showed that risk perception is very low, even among the elderly. 2% of adults under 65 feel at high risk during a heat wave, and no more than 4% of adults above 65, which is very low and can prevent people from taking adequate measures. So next slide, please. The second assessment study was conducted in 2016 to collect the knowledge, setting up and difficulties of management and prevention measures by local stakeholders. So it showed first that there is a low risk perception, just as in the population. They have difficulties linked to the lack of staff and means in hospitals, in nursing homes, and in town halls. And they have also a lot of difficulties to manage city registers. For example, to identify the most vulnerable people at home, mainly the most isolated, to manage the call centers with few staff, and to take care of people when it's necessary to move them in cool places, and to make them accept the prevention measures, which is very difficult for the elderly. Next slide. And the last assessment study began last summer to collect practices of mayors regarding heat waves prevention for elderly, for children at school, for homeless people, and about urban planning to improve urban heat island. So this survey was conducted in all French cities, urban and countryside, small and big cities, and located in different climatic regions. We used online questionnaires last summer, and the results are currently under analysis. Next slide. So as a conclusion, we can say that the heatwave plan is regularly improved, and 2003 is still an outlier with 15,000 excess deaths. But now we can't be sure if it is due to the efficiency of the plan or to the fact that we have never met such an extreme event. As you can see on the graph, it's not very easy to see, but on the upper right part of the graph, you have the 2003 heat wave, which was very intense and severe. But even the most intense heat wave of last summer, in the upper part of the graph, in the middle, in pink, it was not as severe, and in particular, it was very short. And moreover, mortality is still important despite all prevention and management measures. So in the perspective of climate change and more heat waves, we can wonder how to cope with future heat waves in the current prevention system. Thank you for your attention.
Thank you very much, Dr. Laaidi, especially for highlighting how the current plans and measures and alerts have been updated to deal this year with the COVID pandemic. And I think also very interesting to hear the study on the risk perception and yeah, how unfortunately low it is still is. We now have about half an hour for conversation and to answer further questions. And we have had several from our Turkish participants who would like to hear more about the experience from other countries and have some comments and questions. So I'd like to hand over to my colleague Funda for giving us the questions. Thank you.
Okay. So for the session, we would like to do it in English. Regarding that, some of our participants, some of our panelists are not able to reach the translation. So I would like to group in the question and answers. So maybe one first question can be relevant to Umit, Sahin. The question is that why do you think the women are affected most by the heat waves? And do you think there is, what should be the pH of water? But this question is not quite clear yet.
Yeah, the second question, I don't know. I don't have any idea about the pH of water. Regarding why women are more affected, so it's not, the women are not the first risk group, obviously. The most important risk groups are, as Peter already said, the elderly, and especially over 75 years old, people with chronic illnesses, young children, especially younger than 1. It's also very risky, all because of adaptive capacities, etc. And also people who are exposed more heat, like in the occupational settings. Why women? There are several reasons. There can be several reasons. Some reasons can be physiological, also because of the adaptive reasons. But most important reason is probably more cultural reasons, because if you are locked in the inside the home, you can be more vulnerable to the heat waves, because if you don't have enough ventilation, enough air conditioning, etc. So as we know that in many parts of the world, women are more confined at home because of housework stuff, etc. So also this is one of the most important reasons why the indoor air pollution is affecting women more. And we know it especially in the developing countries. So because of this reason, women are also in the risk groups. In our study, in only one heat wave, women was a bit more vulnerable, but it was not very high risk. So in our studies, cardiovascular diseases, people with the cardiovascular diseases and people over 75 years old were more vulnerable, more at risk. In only one heat wave in 2017, the risk for women was a bit higher, but it was not a big risk, as I said before.
So the next question maybe can be relevant.
Peter, just to add to that, there's some studies that say that women have a lower body surface area compared to men, and then sometimes a higher body fat percentage than men, which also changes the metabolism and the coping with heat. So those are a few physiological factors that are known.
Yes.
So we also have an interesting question about insurance. In some countries, we have agriculture insurance, also in Turkey. So one of the participants wanted to know whether is there a kind of climate insurance in other countries, maybe I think European countries, maybe you can, if there is an example, and do you think it can be a solution to this problem?
So I try to answer it. I think for sure you can insure yourself for everything. I think there probably have been some insurances for events, for festivals, or etc. But then it's more like climate change related extreme weather events that you can insure yourself. I don't think there are personal insurances possible to prevent getting any disease because of climate change. And especially as long as there are countries where they are still in denial for climate change. So I don't think that it would be possible. yeah, but it's and anyway, it's not a solution to climate change. Insurance is not a solution. Insurance is just to get your money back if something happens. I think so. It will not prevent any climate change and heat waves.
Also, in the European countries, Peter, is there any kind of prevention other than the early warning system? Is there a kind of prevention on the agricultural loss regarding the climate change or regarding the extreme heat waves?
Yes, I think there are quite a few studies done also by the more UN global agricultural, and I even saw in Umit's presentation that if you looked at the one slide where the soya production even goes up percentage-wise in the world due to heat waves, because and other crops go down, so temperature really has to change on the soil situation, the humidity of the soil. It has to do with the blowing away of fertile top surfaces of agricultural areas. So certainly there are studies in areas where they have been looking at it and changing over the decades already of how climate, temperature change, humidity change, how it influences agriculture. So I don't know if that does that answer the question?
Yeah, I think so. I think it is just more or less answer the question, and it is also just clear that an insurance, also for the agricultural insurance, is not a solution to climate crisis. And also, maybe Karine, I think you can be the person who transfer this. Is the early warning system in France is national based? Is it applied in all the cities of France? Do you find it useful? Oops, Karine, we are not able to. Okay,
Is it?
it's fine. Yes.
You hear me now? Yes.
We hear you.
Okay. So in France, the early system for heat waves is national system, but there is a local. There is also local. Yes, there is a local systems in the different regions with the same indicators, but it is declined locally, and some cities decided also to have their own system and to have specific measures. But the global system is national.
So
May I say
please
something
go.
about that? I think it's very important, also as question, and as Karine said, I think there should be both national and local warning systems and action plans. Also in Turkey, I believe that's so, because heat waves should be defined for locals. For example, something like 35 degrees can be normal for Adana in Turkey, for the south part of Turkey, but it's very hot for Istanbul. So the threshold for heat waves should be defined locally according to the vulnerability and according to the mortality in that threshold in the city. It should be defined for Izmir, for Istanbul, for Adana differently. But after all these studies, there should be a national heat warning system directly linked with the meteorological organization, like they did in France with the Météo France. So, and the prevention and all the precautions should be taken by the local authorities, including municipalities and the local health authority. I think there should be a kind of hybrid system to coordinate all these efforts for the national government and the local authorities.
Yes, and that's it. Do you hear me? Yes.
Yes.
Yes, and that's exactly what we did in France. So we defined the thresholds locally because it needs to be adapted to the population acclimatation. And then we have a national warning system, but the thresholds are local. So in the south of France, where it is hotter, the thresholds are higher than in the north of France. So it's very important, and it's linked to mortality data.
May I add to that, in our country, we're small, so we don't really have too many different temperatures, although there are some. But what we did, I was the author last year of making a translation from the national heatwave plan to a local heatwave plan. And we are currently introducing that into all cities and municipalities, which is much more like an action plan and giving all the tasks and assignments to all the local authorities, ranging from the Public Health Institute to the Red Cross to home care organizations, so they really know what to do when they get a warning out of the national system, so that they can adopt this plan to the local situation. And maybe that would be useful to see. We are glad to share it, but it's in Dutch, of course, but maybe through HEAL or some other way, maybe one day we can see how such a local heatwave plan can at least give you some idea of what you should consider. It deals with elderly people, with social vulnerable people, with events, sport events, etc. So it addresses all these different kinds of activities and people where you should have specific tasks and actions in place to really make it plan that is adoptable at a local level, so that people know what to do. Because a national level is usually only a warning system and drink water inside and use ventilation, but this goes much more into detail of what you can do at a local level. So just an idea.
Also, we have like over 50 participants today, and I think they also just wonder what will be the next step, but we can just initiate from this webinar. So from my perspective of what I heard is that maybe it would be best to start from the local level with some health actors initiative and build the pathway through a national agenda, because unfortunately in Turkey, as you say, that we don't have an early warning system. Only a few health actors, also like today in the meeting, has been just working on this kind of surveys. Also, would your suggestion would be the same, like starting from the local level by building some initiatives and reaching to the national level? Would you also just agree with this kind of approach as European actors? Peter, do you think starting from the local would be a better idea rather than doing some advocacy through to Turkish government or municipality, or sorry, for ministry?
I think you should do both. If you don't get the support from the national level, especially in the warning system, collecting the data and really giving support to look at the impact. If everybody's going to do that differently at a local level, then you might create a lot of confusion. So I would say all the monitoring and the data collection, etc., and the early warning system probably needs to be done on a national level. But if you really look at implementation and actions and giving support to the people and addressing the vulnerable people, that's something that you should do at a local level. So I think both.
Toker Hocam, maybe this one can be a question for you. Do you think WHO in Turkey would also start this kind of a training or initiative? Do you think WHO in Turkey would like to, or do you plan this kind of initiatives in the near future to work on preventing the heat waves or to building up an early warning system on the heat waves?
Actually, as WHO country office in Turkey, we are working with the government by 2 years work plans, and we call that biennial agreements. But I think that this is a very important topic. But as a country office, we are planning to work especially with the Ministry of Health on the heat wave issue and effects on the health. And I hope after this COVID-19 pandemic, when we will go back to normal work with the Ministry of Health and maybe the Ministry of Environment, we will be happy to work with them on this topic. I think it is very important.
Toker Hocam, do you think it is also, can we also just link with COVID-19 and heat waves? Also, that was among the questions. Do you think, is there any possible ways?
Yeah, actually, for the heat waves and COVID-19, our vulnerable groups are the same groups. People above the late 65 years old and also people with the chronic conditions are both vulnerable to the COVID-19 and also heat waves. Also, it is very difficult to use the masks and personal protective equipment during the hot weathers. And so also we have some problems to use the ACs during the COVID-19 pandemic. So I think these are important things. And so maybe in Turkey, as WHO countries, we need to work more with the Ministry of Health Turkey on these issues, but also WHO has developed some guidelines for the using of the personal protective equipment and also air conditions and also how to protect especially elderly people and people with the chronic conditions who are living in the nursing homes. And we have already developed some guidelines, and maybe also Ministry of Health is working on this guideline. So I think that these are important topics and we need to work on that issue together.
And maybe would you like to add upon that, and also just regarding the fact that sometimes getting data from the Ministry of Health or Directorate of Health at local level can be hard. We also have a participant question that they want to work on heat wave relevant deaths, such as just done in Europe and especially in France, but there are some problems for the data sharing. Do you think will it be possible, or is there an alternative ways for health actors to carry this kind of surveys and this kind of researches?
I think it is possible, although not very easy. I think it's better to apply for a research project and then go to Ministry of Health and not directly to Ministry of Health, but local authorities of Sağlık Müdürlükleri in the Ministry of Health and ask for this data. The problem is not the actual data, but the problem is about the past data, because in order to do these kind of epidemiological studies, you need to compare, you need to first, you need to define the normal, also not only for the temperature, but also for the number of deaths and daily number of deaths. And then you should compare the day of the heat wave with the previous years. The problem for us is daily number of deaths were not collected. I don't know, they are collected only in the last 10, 15 years. So, and you cannot really compare a day, the number of deaths in a day with the number of deaths in a month or in a week. So it's not possible to make this talk. This is the main difficulty and challenge for this kind of epidemiological studies, but there are ways. So you can still ask for this data and you can still adjust the methodology for this kind of challenges.
Yeah, actually, also, Fundano, I would like to say something on that issue. As Umit mentioned that also it is very important to monitoring and evaluation of this effect of the heat waves in Turkey. And also another important, we need to find comparable and reliable data on that issue to compare the different years or different times of the season. But also I want to maybe give a message to our Turkish colleagues. If they would like to work on that issue or they want to organize some studies, also as WHO country office in Turkey, we will help them. Also, we will create some contacts with the Ministry of Health, especially the Public Health General Directorate of the Ministry of Health, also to ease their work at the provincial level, or if needed, also through the Environmental Health Department of the Public Health General Directorate of the Ministry of Health. Also, we can help them to organize this kind of studies to reach to find reliable and accurate data at a province level.
Thank you, Toker Hocam. I think it is very valuable for all public health actors. And Peter?
Can I just go back on heat and COVID and share my screen? I don't know, can you see this now? This is from the Global Heat Health and Information Network site where we have been
We
working.
can't see it yet. Sorry, Peter.
Okay, then
Please check.
This one?
Yes, now it works.
Okay.
Mm-hmm.
This is work that's been done the last couple of months, initiated by WHO and the World Meteorological Institute and other people that are forming the Global Heat Health and Information Network. And here is a lot of information about heat and COVID. There is a video, there is a technical brief and a planning checklist on managing heat and COVID, but also interesting a lot of Q&As on the vulnerable population, seasonality, ozone, issue for health workers, issue for city planners and action planners. So all these are topics where there's a lot of Q&As, which gives a lot of up-to-date information on heat and COVID in combination. So maybe this is something to share or to use if you are dealing with heat and COVID at the same time in public health. And there are also, besides now this special link to heat and COVID, there's also a lot of information on heat health and heat waves, etc., and planning issues and meteorological models, etc., which you can find here on this website.
I think quite useful. So regarding of the time, maybe, and do you have any further question to catalyze all the presentations, maybe?
I think they were all really rich presentations, so it's hard for me to make a summary. But one thing I'd like to say to conclude is I wanted to thank all speakers here for showing us various materials and information there is, and I think that's one thing I've identified for us as HEAL. I think as a follow-up, number one, we'll be sharing an email with all participants on some links and further information that was identified today, but then certainly check how within our modest means what kind of translations we can provide, because I think that'd be very important, and that's part of the mission we have as our organizations is to make information available in as many languages as possible for then the health actors to be used where they need it. And I think there's definitely a great interest I'm hearing here, and a further need to do this kind of work in Turkey. And I think with that, I would actually like to close the webinar with a round of thanks. First of all, to our speakers, thank you all so much for your time and for sharing the information with us and identifying some next steps that we can build on with the participants. So a round of thank you to all of you participants as well who joined for 2 hours and listened and shared your questions with us. Then I would like to thank our 2 translators tonight, Sharon Bektaş and Esin Aslam. Thank you very much. We couldn't do it without you. And this was actually the first webinar that HEAL organized with a translation. Whew. So yes, it worked out well. We had some glitches, but overall I'm quite happy that this has worked out. And this is a good basis for further conversations we can have between Turkey and other countries. I would like to thank our funder, the EU, for supporting this project and the work we're doing in Turkey on engaging the health sectors. And last but not least, I would like to extend a big thanks to the HEAL team, to Funda and Berkay for bringing us all together, for organizing this webinar, and to Elke for the technical support. And thank you all. Have a good evening, and see you at one of the next webinars.
Okay, thank you very much. Have a
Thank
nice
you.
evening.
Thank
Bye
you.
bye.